respiratory inflammatory syndrome that people do not know about. But even if we come down to how within the pandemic we have seen that all the conventional medicine practices kind of failed because there was so much pressure on the health service industry that, ladies and gentlemen, they didn't actually had place. We used to actually kind of make separate quarantine centers, which were probably 1,000 or 2,000 or 3,000 beds as well. The hospitals just couldn't rely on the systems which they were working on for so many years as well. So that actually kind of tells us that we really need to change the way how we were seeing or looking at things as well, because everybody did fail and then everybody went into quarantine. So it was like going back into Stone Age as well, where you cannot do anything and you cannot help anything as well. Imagine, the best part is, for the very first time I got to know that there's a special university dedicated to make sure that they're going to train the doctors for all of those future challenges which is going to be out there as well. Ladies and gentlemen, the university name is Health Service Academy as well. And imagine that when we talk about it, the best part is that they have created a new discipline which is actually going to make sure that we're going to treat people, that too obviously via internet, because we have seen that learning management systems were even introduced as well. These two gentlemen, one of them happens to be a vice chancellor, one of them happens to be, somebody who's actually a tech savvy, he's actually running a website with the name of Hayat.pk as well. What they have done is that they have collaborated. One of these gentlemen has actually written a book as well, which will be included into the course and into this newer discipline which has been created. But what is that new discipline all about? What is that book all about? How did that collaboration happen is something we're talking about, and how we are going to see that conventional medicine will actually take a leap of faith and convert into technological medicine. That's something we're talking about. It sounds very amazing as well.
It does.
So without any further ado, we're very lucky, ladies and gentlemen, that we've been joined by the Chief Executive Officer of Hayat.pk. He is Dr. Azfar Malik. Hello, Assalamu alaikum, Dr. Sahab. How are you?
Assalamu alaikum, sir. Thank you for inviting.
So thank you very much for joining us. Wonderful to have you. Dr. Sahab, just one simple question. I think, and that simple question is that whenever we go to a doctor, the doctor is supposed to ask questions, right? How does it feel to be answering questions today?
Well, I am quite acclimatized to this atmosphere now. It's my, I think, second time. So I'm a bit relaxed.
Wow, that's wonderful. So which is why moving on to the next one, keeping up with the same question, ladies and gentlemen, he happens to be the Vice Chancellor of Health Service Academy. He happens to be Professor Dr. Shahzad Khan Sahab. Hello, sir. Assalamu alaikum. Good morning. How are you?
Wa alaikum salam. Thank you. I'm fine.
So thank you very much for joining us. So, sir, usually it's students coming to your office, sir, please. How does it feel to be answering questions today?
Yeah, I think in public health and in Health Services Academy, we had been doing this for last maybe 10, 15 years.
Yep.
Because public health is new in this part of the world. We are moving towards a new system of prevention and health promotion.
And we will, sir, definitely talk about that.
Yeah.
Let's not jump ahead. So one last question, that me being naughty, honestly, and just because everybody out there wants to have a little bit of fun as well, and that is, sir, did you ever come across a doctor, a female or a male doctor, who came to your university to study a course, and then you realize, yaar, is doctor ko to aata hi kuch nahi hai. Did you ever come across that situation in life ever?
Yeah, it happens. It happens every year. And then there is a challenge: how to motivate them, how to enable them to get hold of the things. And to be very frank, for the last I am here since 2008. So last 13 years. We have entered a lot of people, a lot of students from developing and a lot of underdeveloped areas of Pakistan.
Wow.
So they didn't have that much of exposure. So when they came to Islamabad and when they saw these huge books and new concepts, they were, like you mentioned, very scary, and the teachers were also very scary that how will they manage. But with a little support and guidance and with their commitment, many of them, I'll say 90% of them have gone back with a complete degree, and they are serving at a very high positions in various areas of Pakistan.
Oh, that's nice, mashallah. And that's so sweet to hear as well. I mean,
and they are getting cured. That's what the
that's what matters at the end of the day as well. But now
I got acquainted to it, I think, in 2013, thanks to Coursera, when I attended the first free course on health informatics in cloud. I was in Saudi Arabia at that time, and and when I think in the previous government it started that all the tertiary hospitals could exchange their data, they should be linked.
And they should be able to do that.
Yes.
I mean, CMH systems now do that.
Yes, they also do that. So definitely the pandemic gave it a big boost, and the background of this collaboration with Health Services Academy is that about a month ago, we have a Digital Health Association WhatsApp group.
Okay.
In that group, a simple post came by some of the company. I will not name that, but a person was having a heart attack. He was holding his chest, and the one-liner was, "Take a telehealth consultation." Now, that was something which I discussed with Professor
He
Saab,
might not
that this
even be able to take.
yes,
Yeah.
yes, this is something that should not be, publicized. And fortunately, I had compiled a book at that time.
Health insurance.
Basically, these were the guidelines for the doctors. Initially, they were guidelines that I had developed for the doctors of my company. So they should know which telehealth consultations to take, which to avoid, which are the most frequent telehealth consultations, which are the taboo consultations that you should be knowing that somebody is calling you. So there were some don'ts. On the top of that was the cardiovascular cases where somebody is presenting with a heart pain, just give NSAID, aspirin and refer to emergency.
Right.
Second no was a trauma, anything like suicidal tendency or anything, just refer them to suicide helpline. Any trauma, any injury, any bleeding, you cannot treat them online via telehealth.
Yeah.
So I discussed this with Professor Saab. I said that we are lucky that the curriculum, the text is already there, the textbook is there. So sir was gracious enough. He said that Health Services Academy is already offering online courses, and we just moved ahead with that, and without any red tapes. I'm impressed, and we signed an MOU, and inshallah we're going to be live next month.
Wow,
Brilliant.
and that's wonderful.
That's
and this
good
is something I
news.
want to build up on as well, sir, because usually over here, sir, when we go to different universities, we certainly do not have a lot of choices. People have moved from international relations to so many other degrees which we are still not aware of over here in Pakistan. So first things first, for the HSA to be such a vibrant university where they're including newer courses and disciplines, I think it's a great achievement, and that too, obviously, you deserve that. You happen to be the vice chancellor. Takes a lot of effort. But do you think that we are actually ready with one textbook coming from Dr. Saab? Only we would want other teachers to kind of be trained about that particular discipline and how to impart all of that training. So as the Vice Chancellor of HSA, how do you think that you're going to make sure that each and everything which will be imparted to all of those newer doctors will be so amazing that they will have the skill eventually when they do the course?
Yeah, thank you. Like Asfar mentioned, there is something which is already building up, that is the use of technology in health. So every doctor, every nurse, every attendant even, you saw in COVID, everybody had a pulse oximeter and a lot of gadgets at home, and we never heard of that. There is an disposable equipments and instruments which are used in palliative care. Health Services Academy is basically aimed at promoting health and protecting people, and definitely training doctors for the future.
Yeah.
So, like you mentioned, there is a book and there is a course which is developed, but given the international linkages with HSA, so we have huge international collaborations, and there are many more coming up. So one of the most leading universities of the world, they are connected with Health Services Academy, thanks to our alumni, thanks to a lot of development partners who connect us with those. So as the health system is moving towards more digitization, more technology oriented, we feel there is a need to do something in Pakistan. So instead of thinking about these 20 years from now, like you mentioned, why this was so fast, because we are already, I think, late. So we should have adopted a lot of technology driven solutions in Pakistan at least 10 years ago. So it's never too late when you start it. So we will be doing that, and the new generation which is coming up for public health education in Pakistan, now the time is gone when there were public health students of 40-45 year age. Now people do medicine or BS, it's not just for doctors, it is for all the
Everybody.
graduates.
Yeah.
So they just do the graduation, 16-year education, and they come to public health. So, and they are very tech savvy. They are very, because the young generation, they know more than us in technology. So they love these new concepts, and they also share us with a lot of things, and the world is moving like this.
Exactly.
So you mentioned, sorry,
yeah.
but I really want you to mention some of the, you're talking about international collaborations. Without giving a lot of it away, what are some of the things we should be expecting for you to bring here?
And sir, what's within this diploma as well? Just talk a little about the digital health diploma.
You see, there is a concept that people think that it's only telemedicine. Is telemedicine just a very small portion of digital health? It's not like getting a consultation on mobile or on an app. It's much more than that. You can see every investigation, every technology, every diagnosis, every investigation. You can share it with the doctor, and they can also see it digitally, and they can get back. So it's not just like consultation. It is much more than that. There is a data system which is building up, and that is used in analytics. That is used in decision making.
Exactly.
So we are talking about the future whole operation of a hospital using technology. That is what digital health would be.
So what we are talking about is that we're keeping in mind that, okay, we have all the records. So, we can probably have a prospect of what's going to happen in the future. And I think that's wonderful. And everybody does that. Even the business investors do that. They have the data and analytics as well. But so now here's a very important aspect. Now imagine, so what we are trying to say over here is that earlier when a student would go to MBBS, probably first year, I think that the first thing they were ever taught was to take history, right? And how you need to be out there and ask them whether they had previous illnesses, they might react to any other medicine, or, your blood pressure or heartbeat, and everything goes into consideration, and then kind of move on to, okay, sir, ab bataye kya kharab hai?
Exactly.
So how are you going to make sure that, with telemedicine or with digital medicine, let's not even call it telemedicine because it's restricted to telephones.
Yeah.
On digital medicine, how do you think that will happen? Because over here, one private hospital is not going to share their data with another private one. We can do this with the government, we can achieve this. And it's all about business, and then towards the end, it's going to come down to the money of it.
Yeah, the ethics of medicine will remain the same. You will start with the history, but you will have an advantage.
Okay,
If the patient is follow-up, is coming for the second time, you will have everything on your plate. You will know everything what he was suffering from, and you will ask immediately without losing any time that now what is going on with you, because the doctor knows, and he will tell that last time when you came you had these problems. So the investigations, the drug allergies, the patient's history of medicine, and all sort of investigation will be in front of the GP.
Exactly.
So that is one of the biggest benefit, because when you compare it with the paper-based system, what is digital health? You convert the paper-based into something which is in the form of data. So the paper-based is lost. The people don't, in Pakistan specifically, people don't keep their investigations and their files at a safe place. I don't know when I last got my eyesight checked where the file is. So, but I'll go to that doctor, and he will just enter my MR number or whatever identification number, and everything will emerge on the screen. Number two is like whenever you have this liberty of not only having the past medication history and allergies, you have another thing that is known as clinical decision support system. That is a huge blow.
Clinical decision support system. What is that?
So if you are examining a case, and you put the symptoms and all the investigations into that clinical decision support system, it will automatically generate the diagnosis and options. So it's a mind of the computer which is helping the mind of a doctor. And the mind of a doctor.
Computer doctor?
It's a computer doctor, yes.
But sir, how close is the diagnosis? Is it most of the time 100%?
Yeah, it is because it's machine, so it does its analysis on the basis of an algorithm. So human mind can get distracted. The machine will not get distracted, and still it is the human mind who will decide. The machine will tell you that these are the 4 things this can have, and then you can see what.
But only if we, kind of enter all of those desired results into it, so that we get the desired result.
So that is a very big thing.
It is a big thing, and the people have started to work on that as well. But sir, how do you think, just in connection to whatever we are discussing, how do you think that the doctors will get rid of this habit of, because, how do you think, just in connection to whatever we are discussing, how do you think that the doctors will get rid of this habit of, because, for example, you came over here today, Dr. Saab is here, so a lot of other doctors have been on the show. So whenever, God forbid, there's an issue, we'll be like, okay, so for example, if it's a rheumatologist, I'll call her, I'll be like, I went to the gym, this is what happened to me. She'll be like, okay, clinic aajo. So don't you think that now the doctors will have to give up this habit of calling everybody to the clinic when we talk about the digital arena?
Yeah, I think this is on the other side. It is sort of a convenience as well for the doctor.
True.
Globally, in the COVID era, most of the consultations were being held on telephone or on these apps. So if she or he, your physician, if she thinks it is something which needs to be examined, she will definitely call you in. Otherwise, she can always say, do this and do that. So it is a convenience of keeping the patient at home. Most of the time, the doctors want the patients to be healthy within their own environment.
Exactly.
No one wants
That's
to put pressure on the people and bring them to the hospitals. It is another risk.
Exactly.
You know, coming to the hospital, most of the people in the COVID pandemic got COVID in the
While they
hospital
were in the hospital.
because they were visiting and somebody else was visiting. So it is something which is very beneficial for the
Wonderful.
future.
Well, that
Yeah.
is that is absolutely brilliant. But towards the end, I want to first of all commend over here, Dr. Saab, where you said that in your course or in the book that you're writing, where you said you're also giving guidelines to the doctors, ke ye cheese we cannot take online. I think it is very commendable because we're talking about ethics of treating humans here, right? It is humanity first of all. And Shahzad, I feel like this is something you and I have been discussing for so long in terms of private doctors and their practices over here in Pakistan. Really sorry to say this, but at a point it does get commercial for them as well, right? It's all about
Obviously,
making
you
money.
pay first, then you,
Yes.
even if it's
Yeah,
digital
I would,
consultation.
Yeah,
I
it's-
there's some
it-
interesting aspect here.
Yeah.
Sorry, can I, if I
Yes.
can just complete my question, then you can wrap it up for us.
We recently signed an MOU that we would offer free practice management software to young graduates.
Oh, that's
And the
good.
practice management software is a
Technology, if we can prevent illness and if we can protect the people, that is an additional advantage. Why
Absolutely.
we failed in the COVID? Because there was no treatment. So one of the best and one of the most modern systems which we were discussing before the show, even the most modern and the best health systems of the world collapsed. Why?
Exactly.
No one
Because
knew
they
what
were
to do.
designed to treat.
True.
And if there is no treatment, the system fails. So we need to, and the systems who were very preventive and who were having a protection and a life skill approach towards disease prevention, they didn't go wrong. So Vietnam, South Korea, even China, the system was not high tech but more protection.
Focus on
Preventive.
So this digital health and this digital course will hopefully be working more in prevention of disease and promotion of health.
Wow, that's wonderful, which is why we actually want to congratulate you both as well. Yes, you have
One
something.
thing I want to add that the first engagement by the patient is very important.
Okay.
You must have, like a Babylon app is of USA. Most in stomach, it will ask various differential diagnosis questions based on the algorithms and the data that it has been supported with. Then it will eventually lead whether
Yeah.
you need to consult a doctor or you just take an aspirin and sleep or take a brufen or sleep. So
Okay.
this is what we are looking at in Pakistan. Even if somebody cannot afford a telehealth consultation, at least in Urdu, Sindhi or any local language, they can engage like मेरे पेट में दर्द हो रहा है या वो लिखे अपने symptoms
Right,
Yeah.
right.
and then at least they are guided that actually this is something that they need to escalate to a local GP or not, or they can relax. Any other symptom, this is where the digital health stands apart. From the comfort of their home, they can actually get the first medical chatbot consultation free of charge.
And not a generalized one, actually particular to their case.
Yes, and if there is an escalation needed, it will say that now you need to consult a doctor, you want to consult online or consult your local GP.
Got the point.
Brilliant,
Thank you very much,
brilliant.
Dr. Aswad. Thank you very much, Professor Dr. Shahzad Saab as well for being with us. And it's going to be a milestone which you are on to achieve as well. And we want people to kind of have that sense and knowledge as well, which is beautiful. But God forbid, if you'll still continue to fill in a form, I don't think that you'll be feeling all right as well. It's we do not want to fill in a form. We just want the result right out there as well. So, but ladies and gentlemen, obviously things are going to get better in near future. Please don't go anywhere because we're going to make it much more better than how they were already. How is something we'll be sharing in the next segment. Let's do this. Good morning.